everyone, we are the Group 2 and now we're about to tell you how to check your central and peripheral pulse using your palms or your stethoscope.
The temporal pulse is palpitated on the temple directly in front of the ear. It is used to monitor circulation, control bleeding, and also to check the temporal artery temperature. To easily locate the pulse, it is near the ear where the piece of your sunglasses would cross. I am going to use my index and my third finger to feel the beat of the pulse, applying enough pressure not to block the circulation. Do not use your thumb because your thumb has its own pulse that you might feel. Now I am going to show you where to locate your temporal pulse. Okay, so this is your temple and these are the finger pads. Apply enough pressure on the temple to feel the temporal pulse. Count the number of beats within 60 seconds using your watch.
Right now, I'm going to demonstrate how to check your carotid pulse. Checking your pulse is very important to see how well our heart is working. A good pulse is about 60 to 100 beats per minute. There are many ways to check your pulse, but right now, I am going to discuss about checking your carotid pulse on your carotid artery. Your carotid artery is one of the easiest way in measuring your pulse. Your carotid artery takes oxygenated blood from the heart to the brain. To check your carotid pulse over your carotid artery, place your index and your middle finger on your neck. Do not use your thumb in checking your pulse because your thumb has its own pulse that you may feel. So again, place your index and your middle finger on your neck, just below the angle of the jaw, of your jaw to the side of your windpipe. Your windpipe is in here, it's also called the trachea. You're going to slide your index and middle finger to either side of your neck in this position, and you're going to check your carotid pulse. But a thing to remember when checking your carotid pulse is do not exert force. Do not press it too hard, especially to those people who are older than 65. Be careful when checking your pulse or you may block the blood flow of your carotid artery to your brain, making you feel lightheaded and can lead to serious complications. After finding your carotid artery and you feel the pulse, count the number of beats in 15 seconds and you're good to go.
Hello everyone, I am Jasmine Sedanyo and today I am going to show you how to check the apical pulse. But first, let us discuss what is apical pulse. Apical pulse is a pulse site on the left side of the chest over the pointed end or apex of the heart. So, a medical staff like nurses or doctors might palpate or listen to the apical pulse when evaluating a person's heart health. In assessing the apical pulse, we will need a stethoscope because we will be using the diaphragm of the stethoscope to assess the apical pulse, and also a clock or a wristwatch with a seconds. Now, where can we find the apical pulse? We will find the apical pulse at the point of the maximal pulse or PMI, and that will be found at the first intercostal mid-clavicular line.
The first thing that we need to do is we need to position the patient in a supine or in a seated position. But here, I position the patient in a sitting position. Now, we have to locate the sternal notch, which is between the clavicles. Next is we have to go down slightly and we can feel a hump which is known as the angle of Lewis or sternum angle. Then slide the finger over the patient's left to the mid-clavicular line. Here, you will be at the second intercostal space mid-clavicular line. Proceed downward and count the intercostal spaces until you reach the fifth intercostal space, and that is the location of the apical pulse. The next thing that we have to do is to place your hand over the site. Note the light thumping sensation, whether it is regular or irregular, strong or weak. If your patient has large breast, ask the patient to lift the breast so you can access the pulse. Using the diaphragm of the stethoscope, listen to the apical pulse and count the beats for 1 full minute. The normal apical pulse rate should be 60 beats per minute or greater. In this case, the patient has 62 beats per minute.
If you are having a hard time finding the pulsation, lean the patient over to the left slightly to displace the heart closer to the chest wall. That's all for the apical pulse. Thank you.
If you're going to check your blood pressure, you can first check your brachial pulse. Brachial pulse is felt over the brachial artery at the inner aspect of the elbow. It will palpate before taking blood pressure to determine the location for the stethoscope. The brachial pulse can be located by feeling the bicep tendon in the area of the antecubital fossa. Move the pads of your two fingers medial about 2 cm from the tendon and about 2 to 3 cm above the antecubital fossa to locate the pulse.
Arteries run closely to the surface of the skin at the wrist and neck, making the pulse particularly easy to find at this point. So some medical conditions can be a factor in determining the best place to take your pulse. Like for example, if you have a heart disease or long-standing arteries, it's best to use the artery on your wrist. So here are the simple steps needed to take a pulse at the wrist. So this is known as the radial pulse. So the first step, with your palms up, look at the area between your wrist bone and tendon on the thumb of your wrist. So your radial pulse can be taken on either wrist. So this is your wrist, and this is where your pulse located. Second step, use the tip of the index and the third finger of your hand to feel the pulse in your radial artery between your wrist bone and the tendon on the thumb side of your wrist. So this is your index and your third finger. So you will use this to feel the pulse on your wrist. So like this one. Third step, apply just enough pressure so you can feel each beat. So do not push too hard or you will obstruct your blood flow. So after that, watch the second hand on your watch or a clock as you count how many times you feel your pulse in 1 minute. So at this time, at this moment, I don't have any clock with me, but that's how you do it. And the last step is to record your pulse.
To feel the popliteal pulse, require the patient down with legs straight and relax. Then, you're gonna flex the knee and gonna take both of your hands behind the knee. Put the fingers into the popliteal fossa, which is a diamond-shaped heated area behind the knee. Grasp the knee firmly with the thumbs on the top. If the patient assists you with this, ask them to relax the leg so it's nice and loose and push up again firmly with fingers from both hands. Hold this position for a few seconds, feeling for a firm, deep, regular pull.
So for now, we'll be looking at the dorsalis pedis. So we're gonna turn it a little bit. In this way, we found here the dorsalis pedis. In order to find that, what you can do is to find the EHL tendon or the extension hallucis longus tendon. And that will be your dorsalis pedis right here. So in order to find the posterior tibial, and this is found inside of the ankle, right here, between the back of the medial malleolus, which is the body prominence of the ankle bone, and Achilles tendon. So you'll find it within this area.